So the thing is, we rebranded this whole podcast about 6 weeks ago to be the ADHD Adults podcast, and we forgot. So we've not been calling the podcast what it's advertised as for 6 episodes. So welcome to the ADHD Adults podcast. It was James's fault.
Hi there, and welcome to episode 18 of what is meant to be called the ADHD Adults podcast, to give it the name we gave it over a month ago and then forgot about. I'm James Brown, co-founder of ADHD Adult UK, registered UK charity, and to the obvious, clear, repeated disappointment of our tiny band of dedicated listeners, I'm joined by the man with a face like an infected scrotum, Alex Connor. Hi, Alex.
Salve. Nofri.
What?
I've been like studying the welcomes of dead languages. So that was
of course you have.
Ancient Latin and Coptic, like hieroglyphic Egyptian. That's what they would have said.
What
Salve.
Continuously?
Salve.
Can you not help him out, Samantha,
Sorry.
please? Thank you. What continuously surprises me about this podcast, Alex, is I think I reach kind of peak hatred for you. I think I get to a point where it's not possible for me to loathe you anymore. And then episode by episode, you push that boundary, you push that envelope to a point where I think, no, actually, I'm going to kill him one day. I'm actually physically going to strangle him when he does these hellos. So, I'm
well within your rights.
I am. I'm almost scared to ask how you are, Alex, but how are you?
I'm very well, thank you, James. As always. Good. Just happy to be here.
Clearly.
Yeah, good. Yeah. We've had a letter as well from our burgeoning 12 listeners. Do you want me to read it?
No, we haven't had a letter.
We have.
It's made up, and so I'm not going to listen. Just not going to listen. Carry on.
We have. It's from Robert from Kidderminster, James. It says James did have executive dysfunction as a child in the childhood department. Thanks, Robert. That's nice.
Still does.
We have Sam, James's wife Sam's here as well. Can I read out a proper one because I liked it?
Yeah, please.
We've had from Katie. We've had an email which says, "I wondered if you could do an episode on your experiences with higher education and particularly PhD studies. Just hearing other people talking about things I experience has been so great on the podcast so far, and I'd really appreciate any tips or insights with my studies." Sorry for the long message. There was a really long message. I haven't read it out, but keep up the good work and thanks for the information and laughs. We really appreciate that, Katie. We thought actually an episode about qualifications in general in ADHD would be a really good idea because some people report medical health professionals who maybe aren't as qualified thinking you can't have a degree if you've got ADHD, which is obviously utter bollocks. And so, yes, we're going to do it. Thank you.
Thank you, Katie. When she said laughs, was it kind of 2 or 3, do you think, over the course of all the podcasts?
Yeah, laughs could be just 2.
And how many of them were due to you, do you think?
And were they at us or with us? I think I know.
Probably at. Anyway, moving on. Thank you, Sam. As usual, these podcasts are a tragedy in 3 parts, and this is going to be particularly tragic today for me. Anyway, we choose a theme. In the last episode, we talked about executive function, or more clearly, how we don't have executive function in ADHD. And in this episode, we're going to talk about a topic that Alex and I are singularly unqualified to talk about. And that's the impact that menopause and peri-menopause have on ADHD symptoms. So we've brought in a ringer. You've already heard interrupting and laughing at Alex for some reason. I don't know why. He's not funny. And you've met her before. It's Mrs ADHD. It's Sam, my long-suffering wife. Sam, hi.
Hi.
Hi, Sam.
Hi.
I'm so happy you're here. One of my favourite things is that very slight pauses to ADHD people take hours, which is, if you're not going to say anything in 5 seconds, I'm fucking up. And the other thing is, I love it when you're here because it's the uncomfort that James has from your presence on our wonderful podcast. I'm so glad you're here to embarrass him again.
Oh, you're uncomfortable too. Good. At least that
Yeah.
makes two of us. Alex isn't, of course, because he's a psychopath.
Yeah.
So thanks for that, Al. Thanks for expressing glee at my discomfort. So, Sam, or Mrs ADHD, as you are now legally known on the circuit, I would ask how you are, but you're downstairs, so it seems pointless. But how are you? You all right? I mean, I saw you.
Oh
5
yeah,
minutes
why
ago.
would you bother asking why I am? How pointless. And how could I not be happy with you, the light of my life?
Well, exactly.
Aw.
How could you not be happy? Was
Why
that
would you not
rhetorical?
ask how I am?
I did ask how you are, for fuck's sake. Did you actually listen to the question? I said. Anyway, it appears.
I
Look
love
at
these
Alex's
ones.
face.
Okay,
Hard
so
on a podcast. You're going to have to describe it, Sam. Shit eating, I think the word is.
Yeah. So,
Shit-eating grin.
so it appears that my wife is okay and apparently quite testy, which is going to be good going on later in the podcast. As usual, our podcast is made up of 3 parts, including some evidence-based psychoeducation, then mine and Alex's personal reflections on the menopause. Only joking. That's why we've got Mrs ADHD, Sam, here for that bit. And then the third and final bit is going to be top tips on the area that 2 fat middle-aged males have for you. Again, only joking. Sam probably is going to do the tips for us to some extent, although I'm sure we've got something to add. I haven't, obviously. We'll also have time, Alex, to play our usual game of what has James lost, forgotten, or mislaid this week, to your dismay.
I forget every week.
Yeah, good. And then finally, and then quite importantly, we also asked our followers on Instagram. I don't know if you asked them on Twitter because you're not very good. To tell us about their experiences when it comes to perimenopause and menopause and ADHD. So we're going to read some of their experiences out. So, Alex, I have to talk to Mrs ADHD all the time, and I know firsthand what it's like to live with someone going through both perimenopause and ADHD. It's obviously much harder for me than it is for Sam. So why don't you kick off part 1 with the psychoeducation?
Oh God! Hello, Sam. It's nice to see you. I don't know how I feel doing psychoeducation on issues I have no lived experience in, so I'm going to stick to a little bit of science. I'm doing it. Oh, all right, that was the ADHD adult, probably. So what we have been doing is listening to our community on Instagram to back up what we're saying, and I've got other Greek words in there as well in the with the theme of ancient languages. Okay, so science. There is strong evidence that the hormonal fluctuations and changes in transitional periods of life that women go through seem to influence the symptoms of ADHD even more. That's the 3 M's we're talking about: menarche, menstruation, and menopause. As well, there's the changes after childbirth. That could be a whole podcast on its own. It's brilliant being a woman, I presume. Menarche, James, Greek for from the month and beginning, so it's the very beginning of menstruation.
Alex, listen, my tolerance level's low today, obviously because I'm dealing with both of you. So
no Greek.
Well, I'm just going to leave it as, can you not?
Okay.
Thank you.
So the Greek for around is peri and perimenopause.
You wanker!
The perimenopause is the years leading up to menopause and around it. It can take months or years. The average time apparently is 4 years. During the perimenopause and menopause, levels of the hormones, estrogen and progesterone, they're the female sex hormones famously, those levels decline. I mean, everybody has them, but they're known as that. The levels of them decline, and ADHD becomes more severe. Gents, sex hormones decrease as well if you're biologically male. Just that happens much more gradually over many years, apart from James. And this is called the andropause. Don't make jokes in this bit. It's not appropriate, Alex. The reason we're talking about this is that estrogen regulates the release of neurotransmitters, including dopamine, which we bang on about ad nauseum, James. Which dopamine, as we often mention, is involved in ADHD. It's not all about dopamine, but it's pretty important. The deficiency in the action of dopamine is probably largely responsible for many, many ADHD symptoms that we have grown to know and hate. So estrogen drops and dopamine drops. Perhaps not surprising then that you might face even greater difficulties with focusing and concentration. In fact, one of the drugs used to treat ADHD, lisdexamfetamine, has been shown to improve executive function, which are the higher thinking skills we talked about last week, in menopausal women who do not have ADHD. And atomexetine, which is the single drug that isn't a stimulant that's used for ADHD, has been shown to improve memory, attention, and concentration, executive functions again, in non-ADHD menopausal women.
Are you kind of effectively saying we should be giving menopausal women speed then, Al?
Don't be silly, James. As ADHD tends to be diagnosed later in life in women for a number of reasons. I mean, loads of reasons, most of them probably cultural and because medicine's designed for blooming men, isn't it? And the hyperactivity symptoms decrease in both men and women as they become adults. So, I mean, loads of reasons. But it seems that this specific hormonal change may be a trigger for women who are undiagnosed to realise, in fact, they may have ADHD, as the symptoms might quite suddenly become just utterly unmanageable.
This all makes sense to me as an endocrinologist, as I was a long time ago, because when you study hormones and their actions in the body, you become aware that they control pretty much everything from waking and sleeping and hunger and feeling sexy and sometimes vomiting when you see Alex's face. So you can imagine how a pretty sudden drop in a hormone that regulates dopamine levels is going to cause problems.
You weren't an endocrinologist, James. Sam and I just gave you plastic pipettes and coloured water and told you you were.
Thanks.
Right.
Thanks for just pissing on the first 10 years of my academic career there, Alex.
You are most welcome. Right then. So, James, we're going to read out some of the reflections we've got. Are we doing that at the end or are we doing that now?
No, we're doing it now. We're doing it now before the break. That's going to take us into the break, Alex.
Okay. I think that would be important because we asked our listeners who do have menopause and peri-menopause, something that we are simply unqualified for.
Is it pausing?
Is it me to start?
I thought he'd frozen.
Yeah,
I thought he'd frozen.
No. It's just to let everybody know, just to look behind the curtain, if you like. Our script is color coded, so Alex's bits are in blue and my bits are in red. And on page 1, it actually says Alex, which is written in blue, and James, which is written in red, to read personal reflections on the last page. And Alex has failed to scroll down to the last page to see the bits in blue and the bits in red. They say never work with children or animals. They should say never work with children, animals, or Alex, as far as I'm concerned.
You're just grumpy because Sam and I are having fun at your expense.
I'm not having fun.
No, right, let me read this out. Sam, your bits are in green. He ignored that. Right, Lucy wrote in to tell us, from a personal point of view, I haven't been diagnosed yet with ADHD, and I'm in the early stages of seeing the GP. I used to have the energy to get things done, but heavy periods, feeling exhausted and feeling emotional, that's when I struggle to cope with my ADHD symptoms. So somebody who we're not saying the name of said, my ADHD symptoms become almost unmanageable since starting menopause. Most mornings I now need to attempt to reach my car at least 3 times before I finally have everything I need in my possession and I can leave. My team at work constantly return objects to me that I've left in random locations. I'm smiling because it's so ADHD, isn't it? Or just come to my work table to point out the item I'm frantically searching for that is usually right in front of me. I've always felt like I don't quite fit in with this world. But without the HRT, it was like having a nervous breakdown. The rejection sensitivity was through the roof, and suicidal thoughts were on loop in my brain. The worst thing is that I didn't realize what was happening until a friend suggested it was the menopause.
That's
James.
That's pretty powerful, and so I've got some other reflections here. So we also heard from one of our listeners who said, I'm 45. I got my ADHD diagnosis in October last year, having gone into the perimenopause just a few months before. Both things really exacerbate each other, leading to horrific emotional dysregulation. I'm now, unfortunate in terms of timing, having to try to settle into both HRT and ADHD medication at the same time, which is proving difficult. Basically, it's a total head fuck. Another story, again, from an anonymous listener. I think at this point we've probably covered half our entire listenership, Al. Is listenership a word, by the way?
No.
No, it isn't. Okay. Another listener said, I'm currently perimenopausal and I get unbelievable brain fog in the days leading up to my period. It's really awful. Like I feel like it's unsafe even to drive. And then the last one for me comes from Heleth, who said, the hormonal shit overrides everything. Titration is on hold while I try and sort out the other stuff. I've managed to get a referral to a reproductive health specialist, so now I have someone on the case who really knows their hormonal shit, so to speak. It's an ongoing nightmare, and it's hard to stay afloat, especially as I watch the career I've worked for so long disappear down the pan. Just trying to think straight feels like trying to read very fine print using only my peripheral vision. It's frustrating, exhausting, and practically impossible. I feel so stupid and useless. And the last bit to you, Alex.
Awesome. I know it's in blue. I've seen. I needed a moment, to be honest. These are, this is our tribe, and I hate it. What we also heard from the perimenopause doctor, Dr. Shazadi Harper, and we're really grateful for her input. She said, I'm so glad this has been highlighted. ADHD is often not diagnosed in young women as it presents differently, as we all know. Women often get overlooked, and then in perimenopause and menopause, because of hormone change, it becomes more apparent. I remember thinking I had it. I couldn't focus or concentrate in the same way. It can be both frightening and frustrating. Sorry, really frightening and frustrating. Absolutely. We're hearing this again and again, aren't we?
We are. And I think that all of those comments, thank you so much for sending them in. Thank you for sharing your perspective, because so many of our community, are in exactly the same position that you're in. And hopefully, at least by hearing that, some of you will feel that you're not alone. And hopefully that, for some of the men out there as well with ADHD, or partners of women with ADHD that hear that, they'll maybe be a little bit more aware of what the issues are. On that note, we're now going to take a break, and we'll see you in part 2 for some personal reflections.
Okay, welcome back to episode 2 of The ADHD Adults. That's the name of the podcast.
The
ADHD Adults.
Alex, it's not episode 2. It's part 2 of episode 17.
It's episode 18.
18. Fucking hell, between us. Other than that, that was flawless, mate. It was flawless other than that. But carry on.
Thank you. I'm going to welcome back to episode 18, part 2 of The ADHD Adults. That is the name of the podcast. So we're talking about perimenopause and menopause, how it affects people with ADHD or those symptoms. So Sam, brings us to you. We already know you're waiting for an ADHD diagnosis. You've banged on about it in a different podcast. So can you tell us about the perimenopause, menopause side of things? As we're both overtly not female. I haven't asked James if he is. So I'm not.
Yeah, of course. So perimenopause obviously affects everybody differently. And I was just thinking then when we listened to the women before that were ringing in, so many relationships break up during this time, and so many women lose their jobs because they just can't perform the way that they did before. It's awful. But for me, it was kind of a slow process. So perimenopause for me started, first of all, with night sweats. I'd just wake up in the middle of the night covered in water. It was like somebody had poured water over me, boiling hot. And I'd throw the sheets off me, but then everything was soaking, the sheets and me, so then I'd be freezing, and it was just awful. Anyway, from then I then started getting hot flushes, and hot flushes aren't just getting hot. It's like there's a rush of almost like adrenaline and heat coming all the way up your body until it gets to your brain, and you want to rip your skin off. It's that uncomfortable and awful. It's really awful. Then I used to get what?
I'm so sorry. Did you know what it was? Like,
no.
Was it obvious to you, or is it like, oh, what is this?
No, because I just thought hot flushes were getting a bit hot. I didn't know what this was, and I didn't know why I was having night sweats. And well, as I say later on, when I went to the GP, they completely dismissed the perimenopause. So I obviously thought I had cancer and I was going to die.
Yeah.
Anyway, then I'd get cold sweats as well, which nobody had ever mentioned, like rushes of cold coming over me. And I've always had anxiety, but this was overwhelming anxiety all the time. It was just excruciating. Depression, which again I've always had on and off. Irritability, which I've always been irritable, to be honest. And
you've got a good reason.
Exactly. Extreme bouts of anger. And I've always struggled with anger, but this was off the scale. And James is nodding. I lost all motivation, and I got even more forgetful than I normally am. My skin got really, really dry, and I had constant nausea. I just felt sick all of the time, like morning sickness, but just constantly. And then because I was feeling sick all the time and sometimes being sick, then I couldn't really eat much. So I lost loads of weight, which added to the whole thinking I've got cancer thing, obviously.
Yeah.
And then because I'd lost loads of weight and my skin was dry and crepey and it went really loose and I looked like an old, skinny, horrible woman, which really affected me as well. Acid reflux, which I'd had for quite some time because I've got endometriosis, so I damaged my stomach taking loads of painkillers. But my acid reflux got so bad, it wasn't just coming up into my mouth, it was going into my nose. And at one point I had it in my sinuses, which was really, really painful. It was just awful. I've always suffered with insomnia, but it was just constant. I just couldn't sleep at all. I had no libido at all. And I had all these symptoms for so long. It was only after over a year that my period started to become irregular. So all of those things you kind of discount at first, because especially when the GP's telling you it's not that, because you just think, well, my periods are fine. And as well as all that, it made my ADHD symptoms, which I didn't realize I had ADHD at the time or was perimenopausal, but it made them so much worse, and didn't just make them so much worse. I lost all of my coping mechanisms, and didn't just lose them, actually. I completely forgot that I ever had them, or what they ever were, they ever existed. It's only since I've gone on HRT that I've started getting those back, which is mental. I can't remember what else I'm supposed to say.
You're not supposed to say anything.
I think.
I know, I don't know if I've answered the question.
Yeah, I think that's probably more content than you'll get in a medical dictionary when it comes to listing the symptoms of.
And that's just me. Everybody has different symptoms, you know.
Yeah. Well, thank you for sharing. Obviously, I'm aware of some of those. I don't pay much attention to Sam, obviously, so I was aware of some of those. The anger, the issue, certainly. Now I know the answer to this question. I don't, because clearly I don't pay attention to you at all. But how did the process make you feel of going through this?
Shit. Made me feel completely shit. I actually made me feel like I was going insane, because I kept going to the GP with different symptoms, and they were treating each kind of symptom as it came separately, because I'd been for a blood test for peri-menopause and it was negative. So I believed them when they said that I didn't have the peri-menopause. So if I didn't have it, then what was wrong with me? I just felt like I was going mental, and I felt like there was something wrong with me, even more wrong with me than I'd already thought there was. Even after I managed to get referred and see the gynae said to me, okay, I'll put you on HRT for 3 months, but if it changes nothing, you're going to have to admit that it's not the peri-menopause. So even he didn't believe me. So nobody believed me. And that just fed into my anxiety, my lack of self-esteem, my lack of self-confidence, and my self-loathing. I just questioned myself constantly. I just thought, am I going mental? Am I making this up? And are these things actually happening? I didn't know what was. Yeah, it was shit. I'm
genuinely struggling to comprehend how that.
Because I'm a complete psychopath.
What's the football on later? No, I'm genuinely struggling. So to sort of comprehend how horrible that must be, and some of those symptoms are the cause of some of the others, aren't they? Like anxiety can cause those, so you must have thought you were this is an anxiety disorder causing this. How horrendous. So you're trying to manage getting, I use the word lightly, help for perimenopause and ADHD, both of which managing hormones and neurotransmitters. That sounds like a flipping nightmare.
Yeah. Yeah, it was. It is. It's still ongoing. But actually, first of all, I realized after the last podcast, I didn't even mention what ADHD is for me. Sorry, I'm shifting around a lot. I do that. What ADHD is for me. So if I can just tell you what my ADHD symptoms were, because these got
Please
worse
do.
with perimenopause as well. So obviously emotional dysregulation, lack of impulse control, always impulse spending, that kind of thing. Busy brain. My brain is so busy. There's so many different trains of thought going on at once that it's hard to concentrate on one train of thought, let alone things that are going on outside my head. I'm easily distracted by anything internally and externally, my own thoughts and things that are going on, easily overstimulated. Shopping centres and parties and things like that are a nightmare for me because there's just so much going on. I forget that things and people exist if I'm not reminded of them constantly, which I know is really, really common, but then it makes me feel bad because I'm neglecting friends and family. I flit from one task to the other without completing anything, which I have to do, otherwise I can't do any tasks. I have tics, I have stim, I have explosive temper anyway without the perimenopause. I've got trouble. I can focus, but just not on the things that I want to focus on. I make careless mistakes all the time because I'm not paying attention. I'm hyperactive, as you can probably see, internally and externally. I interrupt people all the time because otherwise I can't remember what I need to say and I can't remember what they've said. So I now write things down all the time that people say. I have difficulty concentrating on conversations and tasks. I'm always losing and forgetting things, losing track of time. I've got no motivation, difficulty starting and finishing tasks. I invent decisions that aren't real that stop me from starting tasks, like should I eat first or should I have a shower first? And I'm terrible at making decisions. So then that leads to paralysis and I literally just cannot do anything at all. I disassociate all the time, a lot of the time, to cope with what's going on. And obviously rejection sensitive dysphoria as well. So I've gone over what my perimenopause symptoms were. They're what my ADHD symptoms are. So you can see that there's a crossover with some of the symptoms. So like emotional dysregulation, my explosive temper, poor working memory, lack of motivation, anxiety. So it was difficult for me to know whether I had ADHD, whether I was going through the perimenopause, or whether I was just insane. And the process to get help with perimenopause was so long. It took me 2 years. So probably similar to how long it's going to take for ADHD, actually, because that's probably going to be 2 years as well. So anyway, so sorry, I'll get back to the question that you asked. Kept going back to the GP with saying, I think I'm going through the perimenopause because I'm having hot flushes and, you know, even before my period started. So first of all, I was prescribed antidepressants for anxiety and depression, pretty standard. And apparently they can help with hot flushes as well, which they did a little bit. And that was fine because I've been on and off antidepressants all the time, all through my life. And I knew the ones that worked for me. So they did help a bit. And I had CBT, which I knew helped me with my anxiety. And that did help a bit. Then obviously I was referred for my acid reflux because I was losing weight and acid in my sinuses, all that. So they did the gastroscopy. Yes, that one down my throat. Sorry, I forget words.
She makes the same signal for oral sex, so I just got a bit confused there for a second.
Go.
Yeah.
I love what I need to point out though is that this is predominantly a podcast, so no one can see you opening your mouth and
you know what?
We can see each other.
90% of what I say isn't verbal. Does that make sense? Does that make sense? You know what I mean?
90% of what you communicate isn't verbal.
Yes, that's
what
better.
you say is mostly verbal, apart from the guttural growlings.
Gaga.
Oh my god. Yes, so got referred to that. So what they kept doing was treating each individual symptom all the time.
This is what they do.
Yeah, I know. And you know, anyway, in the end, what I had to do, because they refused point blank that I was going through the perimenopause, because my blood tests were normal. This is the thing, if you're under 45, they won't go on your symptoms. It goes on blood tests, which are not reliable because, as you know, hormones fluctuate all the time. So in the end, what I had to do was I got referred for my endometriosis. So I knew I'd get referred to a gynecologist. I got referred to a gynecologist that specialized in endometriosis. He told me all the shit that's going on there, which is awful. But, and actually I regret this now because I should have said, can we treat that and the perimenopause? But I just said, I don't care about any of that. I need you to deal with this because it's affecting every part of my life and I just can't cope. So I got him to forget about the endo, and he prescribed me HRT and said, you're going to have to accept it's not that if it doesn't. Anyway, HRT changed my life. But yes, back to the question again. Yes, it is
7 o'clock.
Because, executive dysfunction, it's difficult to follow up. It's difficult to remember what you've said and what you need to say. It's difficult to remember to go for the test that you're supposed to go for, to remember what you made this appointment for and what things you need to follow up on. So, yeah, it was a complete nightmare. Did that answer the question? I don't know.
I think
no. It answered all questions ever.
It did. Yeah, all questions ever been written, I think, were answered there.
Oh my God.
I think you didn't just read out your ADHD symptoms, you read out the vast majority of common ADHD symptoms, and it's so relatable. A reminder to people that Sam's describing probably combined ADHD, and if you don't relate to every single one of those, it doesn't invalidate yours. It just means that she has combined type. There's lots of flavors of it, and yet again, a lot of the feedback I got from the previous podcast you were on, Sam, is genuinely from 2 people who said, fucking hell, I'm glad my problems aren't as bad as Sam's.
That's amazing.
Was it her brothers?
I know, yeah. One was Jules. Yeah, hi, Jules.
Yeah.
No, it was, one was Jules. I know, but he's not very self-aware. And and the other one shall remain nameless. Okay, so Sam, I know you're going through it, and it's hard to say this is the advice when you're still struggling with many issues. But what advice would you give?
Better than I was. Sorry, carry on.
Exactly, and that's why I'm asking. That's it, and you've also had to do stuff, which is hard for all of us with ADHD. What advice would you give to our 12 listeners, and I think maybe 11 of them identify as females, about dealing with the lack of support and then trying to manage both things happening at the same time?
Do not give up. Keep on pushing until you get somewhere. You are worth it. Look up Dr. Louise Newson. So she's the menopause doctor, and she really helped me. She's got an app called Balance. You need to download it. On that app, there's not only loads of information that you need, you can also log your symptoms, and start logging your symptoms now. Even if you think, do you know what? It's not that bad. It might get worse, and it takes a long time to get diagnosed. So just like with ADHD, start logging everything now, because that builds evidence for when you go to the GP. Start going to the GP now. Just start it as soon as you can. Download the NICE guidelines and go with them so that you know what you're entitled to, especially if you're under 45. You need lots of evidence, and go with the NICE guidelines. If you get nowhere, ask to be referred, and keep going back until you're taken seriously. Get yourself on HRT, get referred for ADHD, take all the help that's offered. Tell people what you're going through and ask for help. And I think as well, what's really important is teach the people around you, the people you're in relationships with, the people that you're close with, about the menopause, about the symptoms, how it affects you. Because believe me, James knows it's going to be rough for them as well. And they need to be the support you. Teach them about ADHD, what it means for you and how it affects you. You need all the help and support you can get. And people will be much more understanding and willing to help if they understand what you're going through.
Thank you.
You're welcome.
I've obviously been quite quiet so far during this podcast because there are, thank you, Sam. There are many different landmine type or pothole type mistakes which I can stumble on when you're podcasting with your wife, who is both perimenopausal and has ADHD, and a complete arsehole called Alex. So I've kept quiet kind of deliberately. But I've got a question which really is just fucking setting myself up for a kick in here. But Sam, can you tell us what impact dealing with both of these issues has on a relationship, and possibly also explain how awesome I've been in supporting you?
and you can choose your relationship with James if you want to discuss, or any other relationship.
Oh my God, yes, you've been amazing. You're so awesome.
Thank you. I'll take that.
Yeah, well, as you know, it had a tremendous impact on our relationship, to the point that I really didn't think we were going to make it through, to be honest. I was evil. Everything you did annoyed me. I've always hated the sound of breathing and people eating. But this was amplified so much. I wanted to kill you at times. And I'm not very good at hiding the way that I feel, as you know. I was constantly abusing you, throwing things at you and at the wall. I was constantly screaming at you, hitting you in anger. And when I wasn't angry, I was low and I was anxious all the time. And I hated myself for it, but I couldn't stop it. I had absolutely no sex drive at all. And funnily enough, this was the only symptom that actually bothered you. Because let's be honest, I've always been angry. I mean, I've always been a cunt. I was just more of a cunt. But yeah, it was the sex drive, I think, that affect you.
Yeah, I'd like to say that was the final straw that broke the camel's back, but it was the only straw, really, wasn't it, Sam? Let's be honest. And the throwing things, I'm really going to disclose what a complete asshole I am now, but I would deliberately wind Sam up just to see her throw something. So I'd know.
Shit.
Yeah, I know. I'd know what her. I didn't know she was fucking perimenopausal, did I? I knew she was angry, and
I didn't know it was ADHD either.
Exactly, but I knew that there were certain things I could do that would make her so angry she would throw her iPhone at the wall, and I took joy out of that, which is really, really evil.
That is really weird.
I know.
Is that like when I use ancient Latin with you?
Yeah, it is. It's exactly like that. Only it's more expensive, obviously. If you do, if you do smash an iPhone.
Anyway, more me. Yeah. Back to the libido thing. But yeah, this was a big thing for us because I've been married before, as you know, and actually I've been unfaithful in every relationship I've ever had, which I now understand is
every relationship. This is breaking news, ladies and gentlemen.
Apart from ours. Well, we know now that it's ADHD, don't we? But at that point, we didn't know it was ADHD. We didn't know it was perimenopausal even. But I remember vividly when I left my ex-husband, him saying to me, there's something wrong with you and you're never going to be happy with anybody, because as soon as you're after that honeymoon period, you lose interest and you're always looking for the initial butterflies in a relationship and you're never going to find it. And I remember James said to me, I think I'm worried about us. And because you thought the same thing was happening again. And I thought, yeah, there is something wrong with me. And this is going to happen with everybody. And I don't know what to do. And I remember being so scared that I was going to lose you. What?
I was just about to say that again, just to remind people, the only reason I said that was because we'd stopped having sex.
Yeah, that's the other thing.
Yeah,
And Sam, I have to pull that curtain open for people as well. So when you're recording podcasts, to try and reduce interruptions, especially for ADHD, so you put your hand up when you're about to say something, and Sam just went, "What?" when James.
Oh yeah, sorry.
You with the shit hair. What?
Insight into my life.
Anyway, when that panicked me, I thought that it was all over for us because it was really bad. It was really bad. So I booked an appointment with a sex therapist and went to see her because I thought there was something wrong with me and it needed sorting. And actually, she was really good. But the next day at work, they had a talk on menopause. And a couple of the girls were going along. So I thought I'll go along too, even though I'm convinced I haven't got it now because my GP says I haven't. So I went along to the talk and I just all of a sudden realised this is it. And I'd just been fobbed off so many times. I believed them. And it was only then, it was that made me think, no, this is absolutely, I know what it is. And I kept going back to the GP then and managed to get referred eventually to the gynae. So, and that was it. Yeah. Fun, isn't it?
Yeah, I realised I actually, I thought I was going to get a bit of a kicking there, but I actually caused myself more trouble by opening my mouth and talking about what a complete arsehole I am. Because I was expecting just to get this deluge of James was useless. He paid no attention to me. I was dead upset. Whenever I cry, he tries to film it and put it on the internet. All of these things.
Yes, which do that.
That's because it's hilarious when you cry. It's really, really fun. It is really funny when you cry. Anyway, yeah. So I'm a bit disappointed in myself that I've.
Sorry, do you want me to lay into?
No. I'm sure you'll do that later on. Anyway, just scored a massive own goal there. So, Sam, thank you for sharing that and for going easy on me in many ways.
Yeah, thanks, Sam. It's genuinely people need to hear it. We need to talk about this. Thank you.
Thank you. Now, before we go to the break, it's time to play Alex's favorite part of the podcast and his favorite game in the world. What has James forgotten, lost, or mislaid this week? But this week, Alex, we have a twist. Now, I have to explain this. Obviously, I know you get confused, Alex, when the rules change. And Samantha's just screamed for a reason.
Sorry.
I know you get confused when the rules change, so this should be fun. But today we're going to play a game of What's Sam Forgotten this week. So, Sam, take it away.
Okay. Ironically, I couldn't think of anything I'd forgotten at all. James had to remind me, and I forget things all the time, multiple things in it. Yep. Anyway, but I wanted to find one that was linked to what we've been talking about today. So, some choices. Did I forget that I was supposed to have a blood test to check my estrogen levels? Did I forget that I should be taking double the dose of progesterone that I have been taking? Did I forget to take my progesterone? Did I forget to put my estrogen gel on? Did I forget I was on my period and so I bled all over the floor?
Oh. So a lot of them are about hormones. I have no idea if you're on HRT or not because I haven't listened today.
I am on HRT.
I know. That's what we've been. That's all we've been talking about. I honestly don't. That could be any of them. Knowing you as I do, and that you want to make me feel uncomfortable, like I do with James. Period bleeding. That's my guess.
All of them.
No.
Yes. Welcome to my week.
We need to release this on a Friday again, so instead of Monday, so people can have a really nice weekend knowing that they're not as bad as Sam. We need t-shirts with that on.
You know what? All of my friends say they're only friends with me because it makes them feel better about themselves. And that's seriously why I have friends. And I've only got two.
Yeah. I know, and both of them are wholly imaginary.
Well, I think that now takes your score to still being 5, doesn't it, Alex? I think I'm right in saying 5 out of about 13 now. But anyway, you're not very good at this game. So thank you so much, Sam, for sharing all those personal reflections and for giving so much of your experience to our listeners. We'll take a quick break and then we'll come back with some top tips and a personal recommendation. See you in a bit.
Hello, welcome back to the ADHD Adults Podcast 18. We've been talking about menopause and peri-menopause and the effect on people with ADHD symptoms. We've talked a little bit about psychoeducation and then some personal reflections, obviously more from our special guest, Sam, Mrs ADHD. And now we're going to give you top tips. Finally, a chance for me, a man, to give top tips to women about the menopause. James, do you want to go first?
I mean, I don't have the best track record of giving tips on this podcast. Let's face it. And my top tip would be ask Sam, maybe.
I think that's what we're going to do. I've got one, and it is the only for me. It's a tip for myself, James, someone who considers themselves a man sometimes. I think the top tip is that we should bring up the menopause at work if you're in a professionally powerful situation, like frankly we are, and if it's relevant, obviously. And amplifying the voices of women who are already doing that because it isn't talked about enough. And things that Sam have told me today were news to me, shamefully. Sam, please help. Tips.
That's a good tip, actually, because you won't remember, but that's how I found out I was menopausal, by peri-menopausal, by a talk at work. But yeah, top tips from me. Yeah.
Alex, you know the rule. Alex, you know the rule. If you make a joke, you have to put your hand up so everybody knows.
Right, sorry.
Yes. So top tips: educate yourself. Learn everything you can about it. Educate those around you. Record everything, and keep going back until you get what you need.
Thank you.
Punchy.
Yeah.
Brilliant. Thanks for that. We've got a product recommendation of the week. I'm not going to read out what Alex wrote down. I'm not. There is some, even for us, there are very few red lines, but that's one. So, Sam, can you remind us of the app? It's
the Balance app.
Yeah,
by the menopause doctor, Dr. Louise Newson.
Fab. So if you feel that this could be an issue to you, download the Balance app, record everything, and follow Mrs ADHD's advice. So that was episode 18 of the ADHD adults. It's written wrong on the script podcast. No, yes, no, yes, yes, it is. No, yes, yes.
What is it?
It's the ADHD adults, where we finally let somebody with some knowledge talk about things. If you want to get in touch about this subject or any other subject, obviously get in touch on social medias at ADHD Adult UK. It's been a pleasure, and we'll see you next time. Bye-bye.
Bye.
Bye.